Hi, I'm Anita Coleman, lactation consultant for Dr. Coleman's office in Waynesville, Ohio. I'd like to prepare you today for your upcoming procedure for frenotomy, where tongue and lip and cheek ties can be released to help moms comfort in breastfeeding and babies' functionality in feeding. A research investigation could show you how this is nothing new. It's been going on a long time. In ancient Egypt, they used sharpened little spears put in fire to cauterize oral ties that got in the way of feeding. In the Middle Ages, midwives would sharpen a pinky fingernail and release the tissue if the baby needed it. And as recently as the 1950s and 60s, doctors kept scissors on their trays to release tongue tie and lip tie. But with the push of formula in the 60s and thereafter, many moms chose not to nurse, and so the need for frenectomy seemed to go down. But now we have on our website the symptoms checklist that you can check out and see what kinds of things can indicate that this might be a possibility, and to have an analysis done by a preferred provider like Dr. Coleman. So ideally, we recommend before the procedure and after the procedure that you get body work to make the baby's body ready for the release. This situation happens early in the baby's fetal development in the early months. And if it's tight in the mouth, it can be tight anywhere else in the baby's body. So getting it released helps the baby be ready for the procedure Dr. Coleman will do. So when you come into the office, Dr. Coleman will greet you and discuss the procedure, and then he'll do an examination where he will let you hold the baby in your arms, and then he looks, and then he does a function test to isolate that tissue to see if it's too short, too tight, or in the wrong place that interferes with the breastfeeding and bottle feeding too. So after he identifies it and marks it on your paper, then he's ready for treatment. So when that's ready and he can help you, we wrap the baby in a swaddle, lay the chair back, give the baby a little numbing jelly that lasts about 5 minutes, and then he uses a soft tissue laser that cuts and cauterizes back and forth gently, quickly to release the tissue. As soon as it's released, then he'll demonstrate the stretching exercises that you need to do after the procedure 4 times a day, like breakfast, lunch, dinner, bedtime, for 30 days to ensure that the new tissue heals long and stretchy, perfect for the baby for the rest of their lives. We do have a video that we'll send you where I demonstrate those stretching exercises. Now, the procedure itself feels like a pinch, and you don't pinch your baby. So babies cry during the procedure, but it's very quick, less than a minute. And as soon as the baby is finished, you pick the baby up and you bounce the baby, you walk the baby, and then feed the baby. And usually the cauterization keeps the baby pain-free for 3 or 4 hours. After that time, and we'll mark it on your post-frenotomy instruction sheet, we recommend infant Tylenol to be given as needed based on the baby's weight every 6 hours. We also recommend something called Hyland's Baby Oral Pain Relief, which is a homeopathic herbal remedy, and you can get it at Target, at Meijer, drugstores, and even on Amazon. And I put that information on your sheet too. And that can be used more frequently, every hour as needed, and can be used in conjunction with the Tylenol. Now, some babies are in discomfort for 24 hours, some babies for the first 3 or 4 days, and some babies as long as a week. You are going to look at your baby, and if your typical methods of soothing the baby don't work, err on the side of caution that they could be in discomfort and help them. This is a surgical procedure. So, like we said, that you do the exercises 4 times a day for 30 days. Don't skip any because this tissue can heal back and reattach. So you want to make sure you do it according to those directions, 4 times a day for 30 days. And don't do any more than 4 either, just 4. That seems to work. Now, we will encourage you to contact your lactation consultant after the procedure because the baby is going to be making some adjustments in their oral functioning. As now it's nice and loose, they kind of have to relearn a little bit. So we recommend that. And then again, the body work to help the baby further relax and get into the mode of comfortable feeding. I will call you the day after the procedure to check on you, and then I will also check in with you at 30 days when the procedure exercises are over. Thank you so much for contacting Dr. Chris Coleman.